All right, so I am excited today to be talking with Dr. Gisela again, and we are going to be discussing mistletoe therapy. Um, as some of you know, we actually have a course that she developed. It's on our platform that goes through how to incorporate mistletoe therapy into your veterinary practice, which is a really awesome technique, and I think a lot of people aren't really familiar with it, which is why we put this together. So, go ahead and tell us, first off, how did you what made you want to become a veterinarian? And then also just tell us how you got interested in more holistic therapies.
So first, thank you so much for having me here. It's a pleasure um, exchanging some information about my passion. So we should start there. That's a childhood passion. I always had this empathy and compassion for animals. And the natural medicine came in my teenagers' years that I understood that was an option, not just the regular medicine for myself. And then later, when I went to the vet school, that already was in my mind that I would like to finish the vet school and start working and learning about natural medicine. Then I got the master degree on homeopathic medicine. And then later, I started studying anthroposophic medicine as well. So that added more 90 years studying until I finished that part.
Yeah, that's really cool. It's awesome that you get to incorporate that into your practice. So then, how did you first learn about mistletoe therapy?
So the Mistletoe Therapy, I started studying when I was finishing a project at the veterinarian hospital in the vet school, but that was related to the homeopathic medicine. And because I was in the veterinarian hospital in a regular environment, all the others vets start sending me the cases, oncological cases, when they didn't have more options, looking for to see if I could add something. And then I started researching more and more options. And then I found out about the mistletoe that has been used for humans for a long, long time.
Yeah,
And this
so when you started using it on animals, were you pretty much the first person doing it with animals?
yes, I would say back in Brazil when I was studying and working there, that was pretty much myself.
Yeah,
I
that's
used
really
to keep
cool.
the animals with me for 3 hours after applying the injections and observing and take measurement temperature and having all that practical um, experience as well. And now we are talking about more than 20 years ago.
Wow, yeah. So you were one of the first people then to, really incorporate it into an animal practice. So just for our followers who may not know anything about it, tell them what exactly mistletoe therapy is and which animals would be a candidate for it.
So the mistletoe is a semi-parasitic plant. This one specific that we work with, it grows in Europe. And the mistletoe actually started there. It's more known there than here in North America. And I got very passionate about this plant because in the same plant, you can find um, some properties in the plant that will active the immune system and also will be active on the cancer cells. And that's so difficult for us to find in the same medication that is provided for the same plant. And so that's very interesting because these two effects are the base of any desired of any oncologic treatment.
Yeah, I spent a couple Christmases ago, I was in Eastern Europe during Christmas, and when the trees are bare, you can really see the mistletoe in them then. So it was pretty cool. It was really apparent because it grows in the trees. So that's pretty cool. Yeah, so tell people what the side effects would be then. So if they're bringing their dog in for traditional cancer treatments, what would the difference be side effect wise between doing, traditional treatments and the mistletoe?
Well, the mistletoe treatment for animals, we don't get those traditional side effects of the chemotherapy, radiotherapy, for example. And you also ask me what kind of animals that we can treat before. So any kind of animal, dogs, cats, farm animals, horses, they respond very well to the therapy. And usually, what we see are kind of a mild fever, which is for us a desirable effect that show us that they are having some activating on their immune system. They can be a little bit more lethargic on the day of the injections, for example. But those reactions, I would not even call side effects, but some individual reactions usually are temporary effects. Like 1 day to 2 days maximum, they should get back to their regular behavior.
Yeah, that's great because as you mentioned, like with chemotherapy and radiation, there's a lot of negative side effects to it. So that's awesome to have an option that doesn't have that. Are there particular types of cancer that tend to respond better to mistletoe, or is it kind of broad spectrum? It works with every type.
It's a broad spectrum. Any kind of solid tumors usually respond well. There is some difference on the guidance and how to use, because we work with more than one kind of mistletoe, and there is different recommendations for different kinds of tumor.
Okay. And is that something that you cover in the online course that you teach, different protocols depending on the type of cancer?
Yes, the course is very interesting. Any kind of veterinarian actually can follow. Even a regular conventional veterinarian can follow the guidance. It's very well described, the general guidance and understanding how that works. And then, of course, later comes the practice. But I am always available for them to follow up later if they need to, some more individual guidance.
Okay, yeah. So for those who are watching, if you are a veterinarian and you're interested in learning how to incorporate this into your practice, you can find our mistletoe therapy course through our platform at holisticanimalstudies.net. And that's something too, I'll put some links to it and also your email in case anybody has questions for you. And if you're a pet owner and you're watching this and you're like, my pet has been diagnosed with cancer and I want treatments, you should encourage your veterinarian to take the course so that they can incorporate it into their practice. So now, if people in other countries want to incorporate this, how do they get the mistletoe treatments? Like how do you acquire it basically? Because I had somebody ask that was in a different country if they could. I think they were in Australia. They wanted to know where their vet could get it.
Well, the mistletoe is available in many different countries. Then we would need to research for each one, the distributor for each one. But if they need some help, I can easily guide them to find some trustful source for the mistletoe, because it's important to know that there is a specific mistletoe that we work that comes from Europe. That's the one that I like to use. So it's important to know where we are getting from and how to use it.
Okay. Yeah, that's good to know. So then when you're doing mistletoe therapy with your patients, are there other modalities that you like to incorporate with it?
Yeah, so the mistletoe can be very helpful for arthritis process because the mistletoe will act as an anti-inflammatory support. Also for autoimmune diseases, it can help.
Okay.
Yeah, I would say any kind of inflammatory process is just a different guidance how to use it.
Yeah, what would that protocol look like if it's just for, let's say, arthritis? How often would they need to get an injection?
Well, the mistletoe is injectable. We would, for arthritis, I think we should use like twice a week,
Okay.
and usually for low doses.
Okay. Interesting. Yeah, I didn't realize that you could use it for inflammatory things as well, so that's pretty cool.
Yeah, it's very interesting. It's very has a very good effect on the inflammatory process.
Have there been any studies on using it orally or is it just injectable?
Well, this mistletoe that we work, it has to be injectable.
Okay.
It's there is an oral one, but it's a different one, so we don't go there for not mixing things.
Okay. Have you had any experience with the oral one? Is it beneficial for reducing inflammation or anything like that?
Not really. It's not the same effect. It's not the desired effect that we want to achieve.
Okay. Yeah, that makes sense. So stick with the injectable then. Is there anything else you want to share with our followers? Anything about mistletoe therapy and how they can learn more about it?
Well, I think the course is a very useful resource for learning. And of course, I am passionate about it. I think it's a very important tool for us to have as a veterinarian to offer for our patients. And it's so amazing that we don't get the side effects. Actually, it helps when we can work combined with the chemotherapy, any conventional oncology treatment that will just help the patient to get through the chemotherapy, radiotherapy, because we are activating and giving support to the immune system. So we help to reduce the side effects of the regular chemotherapy. And it's so rewarding for us when we can help them and help to have a better quality of life. I think that's a big of our goal as a veterinarian. It's the most important thing, right? We cannot remember that animals are more simple creatures, and if they are able to eat well, drink well, having their time out, and usually we can see those results. That's the most important thing, the quality of life of the animal and for that family as well, right? Because that's part of their lives.
Yeah, definitely. Yeah, I agree. And it sounds like mistletoe is definitely something that all owners should look into if they have an animal with cancer. So thank you so much for sharing your knowledge with us today. I think a lot of people will find this interesting and knowledgeable. If you hear anything in the background, it's a baby piglet that I just neutered yesterday that's hanging out in my office, and he's currently playing with his food bowl.
Oh,
So
that's great.
you never know what you're going to find in my office here. If I tilt it down, you might be able to see him down there. Can you see him? He's black, so he's kind of hard to see, but he's
Oh, I
there.
see.
He's right there in the
Yes, we have company.
corner.
That's great.
Yeah.
Thank you so much. I'm very grateful for being here and sharing this
Oh
work.
yeah, you're so welcome. We're so happy to have you as part of our platform, and thank you so much. I'm looking forward to doing stuff with you in the future.
Thank you.
Yeah, thank you.